To touch on the term invisible illness, very often that is what patients who receive the fibromyalgia diagnosis feel that they have, because they have tried to seek care, they have not received any effective care, and as a result of that, they're forced to just kind of silently soldier on through life, carrying that pain forever.
Have you ever experienced unexplained pain or fatigue that lingers despite your best efforts to shake it off? Or do you know someone who seems to be battling an invisible illness? If so, today's episode is essential for you. We're exploring fibromyalgia, a complex condition that affects billions, yet remains widely misunderstood. With us is Brehan Crawford, an expert with over 15 years of experience in treating chronic conditions like this. He'll help us unravel the intricacies of this invisible illness, shedding light on what it truly is and who it affects. We'll also discuss common symptoms and how they can often be mistaken for other issues. What are the myths surrounding fibromyalgia and what's the truth behind them? We'll also dive into the factors that contribute to its prevalence, especially among women. But it doesn't stop there. Brehan will share insights on navigating treatment options and how lifestyle choices can impact symptoms. Whether you're living with fibromyalgia or just curious about this condition, this conversation will provide clarity and understanding. Hey, good morning, Brehan. Thank you so much for taking the time to join me today.
Yes, hello. Thank you for having me, Joe.
Yeah, and look, for me, for a lot of people, when I saw your company, your business online, I was, I've heard the term fibromyalgia, but I could never probably break it down exactly what it is. Do you mind from a basic level, like what that is and maybe who's most likely to develop it?
Yes. So fibromyalgia is a diagnosis that's given to millions of people every year, most of them women, mostly between the ages of 35 and 65 or so, although it can be given to anyone. Men can get the diagnosis as well, and it is occasionally thrown at children. The diagnosis itself really doesn't mean anything other than that you have pain, and your provider who gives you the diagnosis doesn't know the cause of the pain. There is only one objective diagnosis criteria for fibromyalgia, which is pain reported on specific pressure points throughout the body. And if you have, I think, 2 or 3 of those, then they can give you that diagnosis. But the pressure can be extremely light. It's very subjective on the part of the provider. And it's really a diagnosis of exclusion, meaning they have ruled out, oh, you had an acute injury that's treatable, or you have a fracture or migraine headache or something like that. And frequently, it's just given as a throwaway diagnosis to people who are labeled as seeking pain medicine or labeled as being a psychiatric case. And then they're, quietly shuttled out the door and not really given any effective treatment options at all.
So when you say pain, could it be like any sort of pain anywhere in the body sort of
It can
thing?
be any pain anywhere in the body. Typically, physicians will use the diagnosis when the pain is affecting multiple regions of the body. It's not always like just neck pain. And so if a patient says they have pain only in one area, say the neck, a physician will often, order imaging or physical therapy or, a sequence of events that helps them to diagnose what is going on specifically in the neck. But many times patients will report pain in more than one area of the body. You can have chronic pain everywhere. And the physicians, because they have only so much time with patients as required by insurance rules, they don't have time to do a differential diagnosis for multiple regions of the body. And so they very quickly go and grab this diagnosis of exclusion. That's like, this covers everything. Go away now.
No, that's true. You do hear about that, and you start to realize, okay, there really is a time. Because when you're younger, you think, oh, that was a really quick visit. But then you start to realize, no, that's actually by design.
Yes, it is. It's a requirement from insurance companies, and it's why a lot of physicians go into medicine and then and providers of all kinds go into medicine and then get really, really dissatisfied with their career choice after just a few years. Not only is the training incredibly stressful, and then they go through a residency in which they're overworked, pushed to work 80 hours a week, mostly unpaid labor. They get a lot of great experience. They become very skilled providers, but then in whatever specialty they enter, but then when they enter clinical practice, especially if they're in family medicine, if they're in general practice, the limits put on them for how much time they can spend with patients and what they can do during that time. The diagnostic procedures they can order, the kinds of therapies that they're allowed to prescribe are mostly dictated by insurance companies nowadays in the United States. And unfortunately, as a result of that, the patients don't receive the care that they deserve, that nobody's doing the detective work to figure out what's making them sick. And the physicians become extremely grumpy over a period of time where they feel like they're being asked to do more than they can. And it's just a really, rock and a hard place situation for them. And unfortunately, this makes many of them become quite jaded over time. And so you have them where they just start labeling all their patients as crazy. There's a lot of people who feel like once the diagnosis of hysteria was removed from the DSM-4 or DSM-3 at that time, or whatever number was on it, as that was a diagnosis that was given to women who were insane. It was mostly male providers who were seeing female patients and being like, wow, you're crazy, I'm just going to call you hysterical, and that's your diagnosis. Well, of course, that's not real. And so they got rid of that. But unfortunately, diagnoses like fibromyalgia have largely replaced that amongst providers who don't have the time or capacity to listen to their patients.
Yeah, and as I was doing research, I kept coming across this term invisible illness. And I would imagine that if you agree to that, like what is going on under the surface that makes it fibromyalgia versus, like you said, maybe an acute pain from a previous injury?
Sure. Yeah, it's a lot of things. So to touch on the term invisible illness, very often that is what patients who receive the fibromyalgia diagnosis feel that they have, because they have tried to seek care, they have not received any effective care, and as a result of that, they're forced to just kind of silently soldier on through life, carrying that pain forever. In terms of what is actually going on, like what is causing the pain, there are several possible causes. There is no such thing as pain without a cause. Pain is a symptom. And so all symptoms are our body reporting to our mind that something is out of whack. It's an alarm going off. And we have many signs of this, which are classically associated with inflammation, like redness, swelling, itching, pain, and many different things can cause those symptoms to occur. So it's really normal to understand like, oh, okay, I've sprained my ankle or my wrist, because you can see my wrist, I'll use that. So you sprain your wrist, it gets swollen, it gets red, it hurts. You put compress on it, you give it a little gentle heat for 15 minutes at a time, on and off. You get some physical therapy, you do some massage, like help the swelling go down. And over a period of time that heals, and then you go back to normal daily life and you don't have that pain anymore. And that's a very straightforward presentation of injury, inflammatory response, recovery. And unfortunately, there are many things that can cause a chronic inflammatory response that does not complete itself. And so that's usually what's going on behind the scenes that causes something that gets labeled for a patient as fibromyalgia. And those can be diagnosable illnesses that just require a deeper look into the patient's body, like endometriosis for women, which we would think would cause pelvic pain, and often it does, but it can also cause abdominal pain. It can also cause shoulder pain. It can also cause pain in the eyes. And it could be something like Ehlers-Danlos syndrome, which is a genetic issue with connective tissue, where it becomes there's several types of Ehlers-Danlos, but the most common one is where the connective tissue is not very strong. It's a bit too lax. And this is a hereditary issue that people have. There's a spectrum of how severe it can be, but it can be completely disabling. It can mean that people get an injury and don't recover from it the way that we expect them to. It can mean that people have systemic inflammation after an infection. Infections are one of the most common causes or catalyzing events that throws somebody into chronic pain that they didn't have before.
So would there be levels? Do they rule out, like, if you're like a serious excruciating, or could it be excruciating to something that you might just brush off, something so minimal that you wouldn't even consider going to a doctor for it?
Yes, it could be. It could be. And for many people, the pain is just a very low level. It is silent in that respect too, or invisible in that respect too, where the people are just like, I'm just having a bad day. I'm just a little achy.
Right.
It's like if you're on the beginning of a cold or a flu and you're like, just a little, you shrug your shoulders, you hunch forward, you're moving around kind of stiff. You need to sit in the hot tub or take a sauna or get a massage, and then you're fine. And for many people, that's what chronic inflammation looks like. They just have that every day.
Okay, so then that's something that they've just been dealing with, and they've kind of attuned their body to. This is just the way it is, but there's something deeper going on potentially.
Exactly. And that typically will result in, over decades, that can lead them into cardiovascular disease. That can be an early warning sign for something, inflammation in the the arteries, the heart, that's just low level, making you feel really stiff all the time. But over a long period of time, that compounds and can lead to something more severe in the long run.
Is there something, diagnoses that they confuse it with at times?
The stories that I hear from my patients very frequently is that they complain about chronic pain to their physician or their medical provider for years at a time, over and over. And they're given basic diagnostic workup, maybe some imaging, usually just a little bit of a physical exam, like can you turn your head left and right effectively, that kind of thing. If they can't do that, if they can't find anything wrong, oftentimes they're recommended to take ibuprofen or Tylenol, some over-the-counter pain reliever. That's shockingly effective for a lot of people for short-term relief. Unfortunately, they don't work in the long run, and they come with really severe side effects to the degree that many family physicians now feel that ibuprofen should not be available over the counter because, like Tylenol results in, I think, 50,000 visits a year to the emergency room and is the number one cause of liver failure in the United States is Tylenol. And ibuprofen, long-term use of ibuprofen is associated with ulcers and, all kinds of problems in the intestinal tract, kidney diseases, many things like that. So those are short-term solutions. They're not meant to be used long-term. Sometimes people will go to physical therapy. The problem is that when you're dealing with chronic inflammation is supposed to be a self-completing cycle. It's supposed to be a loop that gets closed off at the end. And when you have something internally that's causing that to occur, exercise, the way that exercise works, the way that many active modalities of recovery from injury work is, and like the way that weightlifting makes you stronger, this is a very oversimplification of a complex situation, but for the most part, is that it challenges you just enough that when you recover from that challenge, you feel stronger and better on the flip side of it. But that requires healthy inflammatory processes to be happening inside the body. And if the inflammation cascade never gets a chance to complete itself because of an active infection, because of an autoimmune condition, because of an endocrine system problem, people just exercise and then they hurt more. And so physical therapy can be more painful for people. Resistance training can be more painful for people. And what the job of the clinician should be is to understand what's causing that inflammation and then to get patients through it to a point where the inflammatory cascade can complete itself. And then they can use resistance training, they can use physical therapy, they can use any kind of exercise to reduce pain, to make the patient more resilient.
When you say like this cycle, like what does that look like to someone? How do they know when that cycle of inflammation has been completed?
They'll be out of pain.
That's okay. It's just that simple. Okay.
Yeah, it's pretty much that simple. So inflammation has four cardinal signs, and they're heat, swelling, pain, and redness. And when you have you don't have to have all four to know that you have inflammation. But if you have any of those in your body, if you have that going on and it doesn't complete itself, if you get an injury and don't recover from it, if you get sick with a virus, and then afterwards you just have lingering pain that goes on for weeks or months or years, it's pretty safe to assume.
Yeah. It's okay. Understood. So people are basically going to their clinician, like you said, they're getting sort of Band-Aids, I guess, right? Like these Tylenols, these ibuprofens,
right,
which aren't really getting to the root
or an
of it.
antidepressant.
Oh, right. Yeah.
Which, for some people, like there's a psychiatric contributing factor in fibromyalgia. I mean, I can't tell you the number of patients I've seen. So in my clinic, in my practice, we break fibromyalgia down into 5 stages of treatment. And stage 3 is where we address autonomic dysfunction, which is chronic stress, elevated cortisol levels, some endocrine issues. And in that stage, that's the stage where we also address trauma. And that's something that many patients with fibromyalgia have in their history, whether it's adverse childhood events, growing up as a victim or a survivor of trauma, or working in a situation where living in a situation where they're being continuously traumatized. And this can be little t trauma or big T trauma. It can be an acute single episode of trauma that then changes the brain and changes the way that their body responds to stress from that point on, or it can be an ongoing chronic thing. And in that stage, in stage 3, when I see patients who go through that stage of treatment in my practice, get better, and then the pain comes right back, and it's the same type of pain that we associate with the third stage of treatment, which is typically electrical or burning pain. That's the stages that we use are associated with a specific type of pain. The question that I ask those patients is, what's going on in your life that is causing this to occur over and over again? Because it's a reactivation of that trauma that oftentimes sends them into physical pain. And I can't tell you the number of patients, mostly women, but some men as well, who, when they leave a toxic relationship, when they leave a really bad work situation, all of a sudden pain is gone. Like overnight, lifted.
Obviously, the mental component is stronger than one would imagine.
Yeah, there's a type of pain called neurogenic pain, and it can be something where your nervous system is overloaded with stress, and it can be a physical stress, like a physical injury, or it could be a psychological stress, or it's usually a combination of both. Sleep deprivation can do it, or can contribute to it. Yeah, it's an elevated fight or flight response.
The misconceptions, and we're addressing some of them. Some people might say it's not a real condition, or it's normal aches and pains, like you were saying. Hey, just shrug it off every day, or it just affects women. It can't affect men. What do you think the most damaging misconception is that you've come across?
That it's all in their head. A lot of people think, and because there is a psychiatric component to it, there's a psychological component to it, there's a cognitive mental component to it. Many people easily get tricked into thinking that they can think their way out of pain. And there is an understanding, there is a mindset piece, there's a wisdom, maturity piece that many patients will acquire or develop through the course of treatment, through the course of becoming more aware of their bodies. A very natural, I'll tell you, so we have a stage 0, and which doesn't actually address pain at all, and in fact, for some patients, can make the pain subjectively more severe. But it's the most important stage of treatment because it sets the foundation for understanding that they need to be in touch with what's going on in their bodies. Because when we are in pain, the fastest thing to do, the fastest mechanism that we have as a living organism to get away from that pain is to dissociate from it, is to put a cognitive barrier in place and be like, ugh, I'm okay, and I'm going to make it through. And there's a time and a place for that. It's like where you hear the stories of a mother who's able to summon the strength to lift a car that's fallen off of a person, or it's where like that's hurting them. That's painful. They're going to have an injury from doing that, but they can do it. You hear stories about that from soldiers who are in combat. You hear stories about that from people who have survived terrible, terrible situations. Our bodies are incredible, and we have the incredible ability to survive long-term trauma and even sometimes to thrive in it. However, there is a price to pay for that. And oftentimes that means that after the crisis is over, the recovery is very challenging.
Well, okay, and you've been discussing these stages of pain. What are they in your practice for people listening?
So stage 0 is becoming aware of the pain. It's removing the dissociative effect, if that's still in place. It's actually a journaling practice that we use and a breathing exercise that we use. And the breathing exercise is very different than what you'll hear about in the later stages, which look much more like the kinds of breath work that many people in the wellness field are familiar with, like Wim Hof or the stuff in the book Breath by James Nestor. And I'm a big fan of those things when they're appropriate for people. The stage 0 exercise is actually just learning to watch your own breath without changing it. So a lot of people who are in chronic pain will be holding their breath or will subconsciously be sighing a lot. And it's important just to notice what state you're in. If you're yawning more than you're sighing, that means that your body is actually deficient of gases. You're trying to breathe in more than you're trying to breathe out. If you're sighing more than you're yawning, it's the opposite. You are in excess state and you're trying to breathe out more than you breathe in. So that in the journaling is stage 0. And that sometimes makes people's pain subjectively worse because they're finally able to tune in with their bodies and become aware of the thing that they've been carrying for a very long time. Stage 1, we address chronic infections, and that's associated with wandering pain. And that can be an active infection that someone is still fighting, or it can be the lingering inflammation from an infection that's resolved in the past, like a flu or COVID or Epstein-Barr virus or something like that. which 90% of the population is carrying that or more, but it's a herpes virus family member. And so it's one of those things you get it. It feels like a flu. It's often called mono. The acute symptoms go away after 2 weeks, but it can reactivate over and over and over again. Stage 2 is where we address the microbiome. And so we're looking at digestive function. Fibromyalgia is very highly comorbid, associated with another disease called IBS, irritable bowel syndrome. And so that's stage 2 as we work on digestive function. We help people with nutrition. We help them address food sensitivities so that they can eat a wider variety of foods. Stage 3 is the autonomic function. And then stage 4, we're addressing microcirculation and prostaglandins, which are things that are elevated in the presence of chronic pain when people have an old injury that hasn't been able to physically repair itself very well.
Wow. Okay. That was a cool breakdown of how you just, because you don't think it's, again, your mind goes to, oh, pain, treat it. Like you said, whether it's the pill or, it's not breaking it down to like all of these factors. So starting with breath work, that's.
Yeah. And at each stage, there's a different breathing exercise that we teach the patient. What we seek with patients when we're treating fibromyalgia is not cure, because this is a condition that is a result of multiple factors. Not every patient has to go through every stage, but each patient, we break it down into these stages so that, because these are the most common causes, and if they have a certain type of pain that's associated with that, I didn't explain it all. Wandering pain is stage 1, dull, achy pain is stage 2, electrical burning is stage 3, and sharp stabbing pain is stage 4. And then there is sometimes a 5th stage. It's almost never required. And that's pain that feels, that's lingering after we've addressed those first 4 stages, and it's worse, or it gets better, with heavy pressure. So a lot of people feel good from massage, from light massage, but many fibromyalgia patients, like the diagnostic criteria for fibromyalgia, feel increased pain with heavy pressure. And so that's something that we can address in the 5th stage. But most patients, by the time they get there, they're exercising really well, they're eating really well, they're feeling really good, and they don't have to do that stage. But each stage has a breathing exercise that's associated with it so that patients, once they're through that stage, if the pain comes back, because we use the term remission, not cure, and they could have trauma again, they could fight a virus again that causes a return of wandering pain, they know what to do themselves to get out of that before it requires more intensive medical care.
And how long is it typically between stages or is it different depending on obviously what's going on with that individual person?
It can vary a bit person to person. What type of infection, for example, can determine the length of stage 1. But for most patients, each stage takes about 2 to 4 weeks.
Okay. Yeah. I mean, that's not terribly long, right? In the grand scheme of treating these issues, right?
No. It can feel long when I have a conversation with a new patient about how long it can take. And I'll say, well, there's 4 stages. You've got all 4. We're going to start you with stage 0. This is going to take you 4 or 5 months to go through. Sometimes that feels like a really huge burden. But in the context of an 80-year lifespan, 5 months is not that long. And if they've been in pain for decades and then, by the time that New Year's rolls around, they're feeling better, that's usually that's usually enough to keep them focused on the
good trade-off. Is there any sort of background? You said women are more affected, but is there contributing factors? Are there?
Yeah. So sadly, because the diagnosis isn't specific, because it's a diagnosis of exclusion, it can be thrown on anyone. And the risk factors, like it's usually given to women, and some of that is just cultural. Some of that is because of insurance practices and things of that nature. Many of the risk factors are being female, being postpartum. So women who've had children are much more likely to be diagnosed with fibromyalgia. Women who've had adverse childhood experiences, childhood trauma, or any kind of PTSD situation are more likely to be diagnosed with fibromyalgia. People who have autoimmune conditions are more likely to get it. People who have a history of head injury, traumatic brain injury, or concussion are more likely to receive that diagnosis. And people who have some genetic issues, like I was talking about, like Ehlers-Danlos syndrome.
Would their general practitioner refer them out to someone like yourself, or is it their...
A good one will, yeah.
Yeah, right.
Yeah. There are other contributing factors that we know can help people develop chronic pain too. And a lot of these are environmental exposure to plastics and pesticides and environmental chemicals, endocrine disrupting chemicals. People who've had multiple infections of certain kinds. Lyme disease is a famous one that can cause chronic pain. COVID can cause chronic pain. Epstein-Barr virus, influenza. Many of these are common viruses that people get, and when you recover from them effectively, you feel fine afterwards. But for a certain subset of the population, their immune system just gets triggered into chronic inflammation, like we've been talking about.
Yeah, is the reason that it takes so long is because in the beginning they're not coming to someone like yourself. They're going to a nurse practitioner, whatever it might be, and they're just kind of treating them with the pill or
Yeah. The standard of care is not adequate. It's often over-the-counter pain medicine. There are prescription medicines that are sometimes given to fibromyalgia patients, like gabapentin or Lyrica, pregabalin, but those are thankfully becoming less popular because it's become pretty apparent in the last few years that they're not that effective. They don't really touch the pain very well, and they have a very high degree of side effects. They can cause dependency. They can cause cognitive side effects. There's preliminary evidence that they may be, we wouldn't say causative of, but contributing towards dementia over long-term use.
Oh, okay. Well, that's not good.
No, not at all.
Yeah, that's a lot of factors. Because I imagine like someone that just sort of gets a diagnosis, they probably think, okay, there's a lot of stuff. But are there more natural remedies that you found? Again, obviously, breath work and things that, non-traditional Western medicines.
Yeah, breathwork is very effective for pain management for many people. It's not the only thing that most people need, but it is incredibly effective, especially once people are through those first rounds of treatment. Once they've been through each stage 1 or 2 times, if the pain comes back, doing the appropriate breathwork tends to put them into remission a second time, especially if they catch it very early. Which is great. I love seeing people take care of themselves that way. The other things that tend to be really effective are, when people tolerate it well, is exercise. So whether that's resistance training, which is great for people with connective tissue disorders like Ehlers-Danlos, hypermobility, or Tai Chi and yoga are extensively well studied for fibromyalgia patients. And we think that it's a combination of breathing, of gentle movement, and of developing a lot of neurological capacity, because they involve balance. They involve core stability, standing on one leg, shifting your weight from foot to foot, putting your joints through a full range of motion that they wouldn't normally experience in a gentle manner. That is associated with a lot of pain relief for many people. It's not 100%, nothing in medicine is, but it's still very helpful. In my practice and my specialty, I come from a background in Chinese medicine, so we're using a lot of herbal medicine for patients. And many people will seek acupuncture for care, and they associate that with Chinese medicine, and that can be helpful for some patients with fibromyalgia. It tends to be temporary relief. It's not curative, and it doesn't really advance them towards full remission most of the time, but it's useful as an intervention when they're in severe pain and they want to get out of it very quickly. Acupuncture can be helpful in that respect. Massage too. But for most patients, again, it needs to be gentle for most patients, massage. But for most patients, we're using herbal medicine, and we're relying on botanical formulas that have an evidence basis in China for hundreds to thousands of years. Most of the formulas we use are around 2,000 years old. And we have both the continuous traditional use of those things for long periods of time, as well as the biomedical evidence behind how they work. So a lot of mechanistic research has been done in China in the last 30 years on the pharmacological components of traditional herbal formulas, especially the ones that have been in consistent use. So medicine tends to go in fads. And we see this in the West a lot, with whether it's the new diet that's going to fix everything for everybody under the sun, or some magical medicine like Vioxx that comes on the market and everybody's prescribing it for a couple of years. And then you find out, that's got some problems with it. Cortisone injections are a great example of that too. It wins the Nobel Prize the first year that it's invented. And then I think 3 years later, they put severe restrictions on its use, where you're no longer supposed to get more than, I think, 4 of them in your life now, because it's so dangerous. And China is no exception to this. And so because there are continuous lineages of herbal medicine that go back 2,000 years, we can watch over history and we can see, like, wow, that formula has been used consistently that whole period of time, or 500 years of time. And we know who it's good for, and we know who it's not good for, and we know where it's useful and where it isn't. We know how to make it safe, and we know how to make it dangerous. And then there's formulas that somebody comes up with this idea and they're like, oh, let's try this. And they do it, and it might work for a very short period of time or become popular for 5 or 10 years in one small region for like a specific kind of a virus that goes around. But people will try it in other parts of the country and be like, yeah, that's not really hitting the mark, falls out of use. So tradition is a form of evidence when you have a continuous long tradition to draw from. And just like we have different levels of evidence in biomedical care, whether it's a meta-analysis of systematic reviews of randomized controlled human trials, like that's a very high, like thousands and thousands of patients getting their data gets compiled, and you can know for sure, like that's effective if it superior to placebo over and over and over and over again with a safe track record and not great side effects, versus a petri dish in vitro lab study where it's not in any kind of animal, let alone a human, and it's not compared to a placebo or something like that. So in Chinese medicine, randomized controlled trials are done, but they're expensive to run, and because herbal medicine can't be patented, there isn't a huge profit motive for that. So, because if you do one, somebody can just be like, cool, you use those plants, I'll use those plants too, and they have a better marketing team, and they put you out of business. So it doesn't work like pharmaceuticals in the United States, where you can patent the formula, you get exclusive rights to it for 15 or 20 years. But what they do is they do a lot of mechanistic research. So they'll do a lot of not if it works, but how, and understanding the phytochemical components of these plants and what effects they have on the body. And we have a great deal of data to draw from with that. When you combine that with traditional use, like long-term use over hundreds or thousands of years, we can generally trust that that's going to do something for somebody who fits the pattern that we would use that formula for. And then sometimes we do get higher quality studies, and those are great to see. Or they'll do something like they'll compare a biomedical standard of care to a biomedical standard of care plus Chinese herbal medicine and see which group of patients does better. And it's not the same as a placebo-controlled trial, but it's still if the herbs group does better, we know that, okay, there's some benefit here.
Yeah. Are there other things that people could be doing in their everyday life to sort of reduce the risk of getting fibromyalgia?
Yes, absolutely. The number one thing that people can do to reduce the risk of developing fibromyalgia is build a supportive community of friends. Western culture, the United States particularly, is incredibly socially isolating. And living in nuclear families without extended family support, especially for mothers who give birth to children, postpartum depression is a bigger deal here than it is anywhere else in the world. And a large part of that comes from isolation. And like I was saying before, postpartum mothers are amongst the most common group of people to get diagnosed with fibromyalgia, with chronic pain. A lack of community support is probably the number one contributing factor to that.
I guess the last, 2020, right? Those 4 years.
Oh, man,
that was
the pandemic was rough.
Yeah.
Yeah. A lot of social isolation from that. And that's going to result, we see it now. There's evidence in psychiatric illnesses in children and teens that resulted from that. A lot of those people will be diagnosed with fibromyalgia later in life.
Yeah, there's a couple things I wanted to jump into that I saw on your website. One being the chronic infections, right? Can you walk us through how an infection that can still stay around but be related to fibromyalgia?
Yeah. So this is a fun story. So when we catch an infection, when we catch a virus, our bodies attempt to respond to it in a way that creates conditions in which the virus can no longer live and reproduce. And whether or not viruses are actually alive is a topic of scientific debate. They don't have a nucleus. They don't reproduce themselves. They invade the nuclei of our cells and use our own process of DNA replication to breed. But viruses themselves are not technically alive, which is a little creepy to think about. However, our immune system is capable of recognizing when this is taking place most of the time. And when that happens, it's similar to, in many respects, to when we have an acute injury, like a sprained wrist, where we create inflammation, because the process of raising the temperature of the human body creates an environment in which viruses can no longer live. We also have specific things that happen, like the development of immune cells that recognize a virus that's attached to one of our cells and then go and destroy that cell. And we have cells that recognize viruses floating around in serum that just destroy the virus immediately. When you develop antibodies, your immune system becomes much more able to recognize when a virus is attacking you that's similar to the antibodies that you already have. But the process of doing that creates inflammation. And in many people, that inflammatory process, like we were talking about before, doesn't complete. And so even after the infection is gone, your body can still be attacking its own tissue. And this is why many presentations of fibromyalgia are in fact autoimmune. It's a lingering inflammatory reaction where your immune system is now targeting your own cells, thinking that there's a virus in there.
Okay. That makes sense. Yeah, I was like, wow. So I'm trying to process it all.
Yeah. So one of the best treatments that people can do at home and that you see used in traditional cultures a lot for chronic pain is heat. Specifically, I'm talking about like a sauna, because it's a very gentle, controlled way of raising your body temperature and promoting a therapeutic sweat. The mechanism of sweating has associations with pain relief. We know that sweating and sauna use is associated with a reduction in arthritic pain, especially rheumatoid arthritic pain. We know that it's associated with an increase in cardiovascular health. And then we know that it changes the microbiome of your skin because sweat includes compounds called lactoferrin and dermcidin, which really help to reduce yeast populations and regulate the bacteria of your skin so that your immune system, which is very active on the skin, works more efficiently. If you're very sedentary, your body becomes like a lake. It's just still. Whereas if you're up and moving around all the time, your fluids are moving as well through your entire lymphatic system. And so clear water in nature that's moving, that's like a mountain brook, that's usually safer to drink than something that's just sitting still and has all kinds of algae growing in it.
Murky, yeah.
Yeah.
Well, so you mentioned like exercise. For people that have fibromyalgia, are there specific exercises or certain exercises that maybe help them?
For most patients who get diagnosed with fibromyalgia, this is an oversimplification because, like I was saying, there's many leading causes and many different constitutions of patients that will receive that diagnosis. But for most of them, the kind of exercise that they're able to do consistently without creating more pain is the most effective kind. And that often looks like gentle resistance training, resistance bands, or lightweight weightlifting. It looks like things like yoga and Tai Chi, which have been extensively studied and are very effective for many kinds of fibromyalgia. It looks like going for a 30-minute walk every day. It looks like doing house chores, gentle yard work, if you work in office jobs, setting an alarm so that you get up every half an hour and just walk around the office one time, just a 1-minute walk, just move your joints. That helps a ton.
Yeah, just the movement, just keeping your body in non-stressing sort of movement.
We're meant to move.
Yes, that's for sure. It could be literally just. I even read. I was talking to a woman one time about people who fidget a lot, like their bodies are constantly in motion.
Just sitting there, like wiggling all the time. Yeah,
it's better than just sitting completely still and eating. Right.
There's a time for stillness. Meditation is great, but there's also a time for most of the time if you're not doing that, if we're not sleeping, we should be moving around a little bit.
And is there a recommended sleep? Some people say 7-8 hours in general, but for patients with this condition?
That's a great question because there's a wide variety of what works for people and what doesn't. A lot of people will say, 7 to 8 hours. And for some people, that's enough if it's good quality and it's consistent. Many patients that I see are getting 6 to 7.5 hours a night, and it's broken up, and they have to take a long time to fall asleep. They toss and turn. They wake up because of endocrine dysfunction, like some hot flashes in perimenopausal women, or some kind of pain that wakes them up, or they're under constant stress that they're in fight or flight mode during the night and they never really get into a deep level of sleep where their brain can actually clean itself. Addressing sleep hygiene and sleep health is critical to recovery at every stage.
Yeah, no, I can imagine. And I would imagine that also plays into diet in some form, right? Like what you eat. You mentioned the microbiome. I hear a lot about the gut-brain connection. How does that play into fibromyalgia?
So the digestive piece of fibromyalgia is, like I was saying, it's highly comorbid with IBS. And so there are a lot of patients with fibromyalgia who either will have, I'll tell you what's healthy and normal. Healthy and normal is if you go and Google the Bristol stool chart, there's a like a 1 to a 7, I think, of what your poop looks like in the toilet. And I highly recommend looking at one that's like drawn as a vector graphic. It's a cartoon. It's not actual photos of somebody's poop, unless that's your thing. And you want to be a Bristol 4. And so a 5 is too loose, a 3 is too hard. And then it gets, more severe as you go out from there. And you want to have 1 to 3 Bristol 4s every day. And if you have fewer than 1 bowel movement a day, and I know the official criteria for the diagnosis of constipation is fewer than 3 bowel movements a week, but I will tell you from doing this for a long time, the people who have a nice, easy poop every day feel better than the people who don't. And not more than 3 every day. Occasionally, like you went to a chili cook-off or something, maybe, but that shouldn't be the daily practice for you. And eating foods that contribute towards that, drinking warm water, which contributes towards digestive health rather than ice cold drinks. Lots of cooked plants are really helpful. And, in terms of like the name of a diet that tends to work the best for people, we're often looking at the traditional diets of China, which are very heavy on plants, heavy on cooked plants, heavy on spices, or the Mediterranean diet, which is also heavy on plants, heavy on the use of spices. And then foods like mushrooms that have really healthy prebiotic fibers like beta-glucans that can contribute towards healthy intestinal flora that grow. Those healthy intestinal flora have a great deal to do with the health of our immune system, with the health of our inflammatory cascade, and with how we perceive pain. It's called nociception.
Back to, right, the methods that have been proven for centuries.
And it changes regionally. If you live in a very hot, dry place, eating, very cooling foods, very moistening foods can be really helpful for you. If you live in an extremely cold place, if you're living in northern Alaska, a traditional diet of that region, plants don't grow very well there, so you're eating a lot of fat and a lot of meat. And you need that to survive that kind of a harsh climate. Most of us need to be eating a very moderate diet. We need protein, and animal protein is fine. It's a great source of protein. It shouldn't be too fatty. It shouldn't be too rich. The ketogenic diet has therapeutic potential in specific instances for some people, but for the most part, people should be eating a lot of cooked plants, adequate protein, not too much fat, not too much refined sugar, very little alcohol, that kind of thing.
Yeah, it's weird because, like you said, you touched on that in the beginning. It's all these fad diets that come in, and okay,
they come and go.
Yeah, it's going to be exactly. We talked a lot about challenges. How about like the positive or the growth that you're seeing in people living with fibromyalgia?
The capstone piece of recovery for many patients is development of wisdom that they can accumulate from having gone through an extended trial. It's a long ordeal. It involves a lot of trial and failure, usually before they find an effective path moving forward. And if they're conscious of that, and if they develop a supportive community along the way, they oftentimes find that on the end of it, once they're fully in remission, once they know how to take care of their own bodies and they've really conquered their pain, they find that they are now able to be of service to the world, helping others do this as well. And oftentimes it's just through being a good friend. It's just through showing up for your friends who are going through a hard time, whether it's an injury or a divorce or a prolonged illness or something like that, whether they're teaching breath work to people or because that's very safe. You don't need, you should consult a trainer or a physical therapist or a medical professional before starting therapeutic exercises, and it's not impossible to hurt yourself with breathing, but it's less likely than, taking supplements or medications or something like that. And that's something that classically in many traditional cultures has just been shared amongst people who care for each other.
Yeah, community. It sounds like the foundation to a lot of what you're saying. Sorry.
There are real physical health metrics that you can measure based on people's social patterns as well. So one of the greatest predictive factors we have for length and quality of life is how good are your friendships in your mid-40s, period. We see that people who are more isolated do not live as long. They have greater chance of heart disease. They have higher rates of depression. They have higher rates of neurological illness and dementia. And people who have a healthy, supportive community, who make friends, who spend time with other people, are healthier and live longer, and they have less pain. And when they get in pain, they know how to deal with it.
How about like when it comes to research? Like, is there a lot of like research treatments that maybe are going on that you're excited about that could help aid people with this condition?
There are, like we've been discussing, the treatments that work best for this are rather simple. It's diet, it's relationships, it's movement, it's plant remedies, it's breathing. And the stuff that's getting investigated is often, it lends context and understanding, but the interventions that come about end up being dramatically overexpensive and complicated. They often come with severe side effects. I mean, Lyrica is a very new drug, and it's already fallen out of popularity because it doesn't work that well, and it comes with some really severe side effects. There are always things in development. And whether it's a new device, like some kind of fancier laser or an electrical stimulator that you can have implanted on your spine or on your vagus nerve, some kind of a nerve block or injection that's given to you, these things can be really helpful. And I don't shame patients for doing anything that helps them get free from pain ever. I don't use shame as a therapeutic instrument, but if something helps you live your life, use it. If you're aware, be aware of the side effects, be aware of the risks, but by all means, make your own choices. Unfortunately, the research motive behind most of these new interventions is profit. And when you can patent a medicine and have exclusive rights to it for years and, pay enough money to get it included in the curriculum in a medical school, that ends up making your investors a lot of money, but not really helping people that well.
Yeah. No, it's a shame that that's the health and the profit are so intertwined. So for someone who's listening and they're like, okay, maybe I think I might have this. What would be the first thing that person should do?
So I put out a lot of free content online about this. So they can go check out my socials. I've broken down my office, and I have broken down the five stages 0 through 4 of fibromyalgia. We've broken that down into YouTube videos that are free to watch. Anybody can go check them out. We have an online community through school that people can join for free. And if they want to meet other people along this path, people who have conquered their pain, people who are qualified to teach breathwork to others, and I'm in the group too, they can join that for free and just chime in on threads and ask for help. And we can't give medical advice that way, but we can absolutely point them towards free online resources that they can use to start walking the path towards recovery.
So how would someone connect with you? Like for people who are, okay, I want to talk with him. I want, the YouTube obviously is great, but they want to work directly with you. Do you do telehealth visits? Okay. So what would be the best way to get in touch with you?
Yeah, they can visit my website. It's crawford-wellness.com. They can call my office. Phone number's on there, or email us, or schedule online. They can come to our free school group. The school group is called the Chorus Circle. And
is that SKOOL?
Yes, SKOOL.
Okay, that's cool.
School.
Yeah, making sure.
And the Chorus Circle is completely free, and we do an online live in there once a week where we talk about topics of interest to our group and do a Q&A and look at people's tongues, which is a fun aspect of Chinese medicine diagnostics, and kind of tell them, okay, you got some fluid retention, you got some inflammation, you got some blood stasis, tell them to go watch stage 1. That kind of thing.
So I'll make sure that that's in the show notes. And listen, thank you so much for joining me today. I mean, I personally learned a lot.
Thank you so much for having me, Joe. It's been a pleasure.